after the studying the different circulations, as we have come across the first one, systemic circulation. Then we have studied the pulmonary circulation. Then we have studied the coronary circulation. Then portal circulation. So one more circulation important thing which is you have to remember, that is a fetal circulation. It is a different. Why it is a different? When we see the systemic circulation, it is a different in the manner because lungs are non-functioning, because lungs respiration is not there in the fetus, so that lungs are they are not working. So non-functioning lung, because that one is important. Then whatever the oxygenation is done at the placental level, placenta is the organ where the oxygenation takes place in the mother's placenta. Then third one is, it is a very important because it bypasses the portal system. Whatever the portal circulation is there, portal system is there, it bypasses. So because of this, there is a very important and different in the comparing to the others circulation. So very important fetal circulation I have kept last because after studying the systemic circulation, pulmonary circulation, coronary circulation, portal circulation, you can very well understand. We are going to revise even other 4 circulations also. But why this fetal circulation is important and why it is a different, that you have to remember. So first point I have told, it is a very important to know, because the things I am going to talk is why it is a different than the systemic circulation. So I have told first point, as this is a placenta is one of the important organ for the oxygenation, and lungs are non-functioning and it bypasses the portal circulation. Relating to the portal circulation bypass, then second I have told the lungs are non-functioning, then I have told that is the placenta will act as a respiratory organ because oxygenation is done there. Okay. So how the fetal circulations start? You have to remember first one, when you take the one organ which is, you can see this as a placenta. So you can remember this is a placenta. So this placenta is attached to the uterine wall, uterus. Baby where growing in the female reproductive organ, we have the uterus. Inside the uterus, fetus is growing. So in that, the wall of the uterus, there is an attachment of the placenta. Any wall of the placenta that is attaching to the wall of the uterine wall. Okay, and this one consists which is you are going to get this placenta, which is consists the one cord we are going to call that is the umbilical cord. Okay, so this is the one which is we call arising. This is the umbilical cord. Okay, this umbilical cord which is consists the one that is one vein which is we are going to call, this is we call it a placental or umbilical vein. So I have told placenta, umbilical cord. Umbilical cord contains that is the umbilical vein, and this vein, umbilical vein, carrying the oxygenated blood. We are going to call vein, blood it is carrying the oxygenated blood. Then this umbilical vein, when it reaches to the one which is the organ we are going to get, that is we can get as that is the liver. So this is the liver. So in this liver, whatever you have come across, it is having the portal system we are going to get, and in this we are going to have the portal vein, and we are going to get the portal system or the portal vein. So this umbilical vein which is there, it will bypasses the liver and it joins with the left. Portal system is bypassed because this umbilical vein is directly opening into the, that is we have the portal vein, and this portal vein and that will opens into the, that is we have the inferior vena cava. Okay, you know now inferior vena cava base. So here when you go to the heart, in that you have to remember heart structure. We can take out. So this inferior vena cava is opening, that is into the, which is the opening into the right atrium. Okay. So this inferior vena cava. So I hope that is you understood. That is a placenta is an organ for the nutrition, oxygen supplying to the fetus. Then we have the attached, that is arising umbilical cord. Umbilical cord contains the umbilical vein, and this umbilical vein bypassing the portal system of the liver, but this umbilical vein will joins to the portal vein, and this left portal vein, and this left portal vein will be directly, that is a continue and connects with the inferior vena cava. This inferior vena cava, here blood which is reaching to the right atrium. Then from the right atrium directly this blood goes through the one opening is there here. You are going to get one opening, that is the foramina ovale. Fossa ovalis is a remnant which remains after closing, but we are going to have the foramina ovale. This is the opening between the two atrium, right and left atrium. There is an opening that we call as a that is a foramina ovale. That is blood from the right atrium reaching to the, we are going to get the left atrium. Okay, listen, left atrium. Is it clear? So left atrium, it is directly coming, but systemic circulation how? Right atrium to the, it has to go to the right ventricle. So blood from the, that is the right atrium, that is goes to the left atrium, passing through the foramina ovale. Okay. From here, foramina ovale, that is the reaching to the left atrium. This blood will reaches to the left ventricle. Okay. From the left ventricle, when you are going to get this left ventricle, aorta begins. Okay. This aorta is begin here. Have you understood? So from the left ventricle, blood goes to the aorta and neck part, and remaining part of the body is supplied by the branches of the aorta. But some part of the blood, which is we are going to see, where reaching to the right atrium, here right atrium, comes to the right ventricle. Some amount, less percentage of amount, because 80% will go here, means remaining about hardly 20 to 15% of the blood which is reaching to the right ventricle. From the right ventricle, this will be pumped into the pulmonary trunk, and this pulmonary trunk is having the right and left pulmonary. We are going to get the, that is which connect to the aorta, and this is we call as a ductus arteriosus. Ductus arteriosus means from the right ventricle, blood pumps into the pulmonary trunk. From the pulmonary trunk, it has to go to the lungs, very less amount where supplies to the right and left lung. Then remaining maximum, which is pumped from the right ventricle, blood almost all goes to the left. Maximum blood is going into the, adding to the aorta. That this we call as a ductus arteriosus. So you have to remember this will be joining umbilical vein to the portal vein, and that is we call as a ductus venosus. Okay. Then we have come across this all inferior vena cava reaching blood opening into the right atrium. Directly from the right atrium, blood goes to the left atrium through the foramina ovale. Okay. Then the blood from the pulmonary trunk with the communication that is going from the, we are going to get the left pulmonary the aorta, and that is the maximum remaining part which is there, that is going from the pulmonary to the aorta, and this communication we call as a ductus arteriosus. Three important stages, three important words you have to remember. Here you have to ductus venosus, then foramina ovale and ductus arteriosus. Okay. So these two remaining total, and whatever blood is coming to the aorta, when you go to the aorta, this aorta is distributing to the whole body, almost all the abdomen, thorax, lower limb, all. This will be divided into a, that is a common iliac artery. And this common iliac artery which is there, that gives the two branches, that is reaches blood which is to the, this we call as an we are going to call these two branches umbilical artery. So aorta from here, common iliac to, we are going to get the, that is almost all circulated blood which is brought to the again umbilical cord. Through the, we are going to get the umbilical artery, and that is comes to the again to the umbilical cord and placenta, and adding to the mothers. So this way the fetal circulation occurs, and here we call as a two umbilical arteries and one umbilical vein. Umbilical cord contains the one umbilical vein and two umbilical arteries. So that can be the, you have to remember in the total. So this is what you have to remember about the fetal circulation. So three important words you have to remember. Lungs are non-functioning, so that why whatever the blood which is from the pulmonary trunk not going much to the lung, only few percentage of blood goes to the lung which is required supply lungs. So that much only goes, remaining part will be goes directly right to the right atrium to the left atrium, and whatever the part which is reaching to the right ventricle, that will be pumped into a pulmonary trunk. Few amount goes to the lung for the supply, and it bypasses through the left, and this channel is very important, that is we call as a ductus arteriosus. Here we have the umbilical vein to the, we are going to get the portal vein, and opening continues, blood goes into the inferior vena cava, and this channel we call as a, that is a ductus venosus. And this one opening, there is an opening between the two atriums, and that is we call as an foramina ovale. Foramina means opening, foramina ovale. So this is very important, you have to remember. Remaining all the blood which is from the supplying to the body supplies, and almost all the blood which is with some percentage of deoxygenated, which is from the common iliac, that is giving the branch, that is arises to the, that is umbilical cord, that is we call as a umbilical artery. These two umbilical artery joins and comes to the, we get the umbilical cord and placenta. So this is the one which is you have to remember in fetal circulation. I have told the why it is the important. Then I have told the why, what are the difference between the systemic circulation and fetal circulation, and what are the three important structure name you have to remember, that is ductus venosus, foramina ovale, ductus arteriosus. What it is you have to remember now. Then you have to tell after the how it is general circulation or systemic circulation which occurs. When you see the immediately after the birth, when baby or the child breathes, first breathing, then there is a functioning of the lungs. So that time immediately the ductus arteriosus is closes. Here you can get as a ductus arteriosus close, and that will be from the right ventricle, blood directly going to the lung for the pulmonary circulation. When I am talking immediately after the birth, when first breathing occurs, that time this ductus arteriosus is not remains, it will close off. So that this ductus arteriosus closes one step. Second step, there is a closure of the atrioventricular orifice, that is we have here interatrial one opening, that is foramina ovale, that also closes. So blood from the right atrium not going to the left atrium, it is coming to the right ventricle and pumping to the pulmonary trunk. Then one more here, umbilical vein, which is communicating with the portal vein, so that also closes, because abdominal almost all the aorta, which is portal circulation, begins. So these three steps which are there different than in the comparing to the systemic circulation, they are closed then immediately after the birth. Sometime in some cases they remain patent. They remain even after they have to close, but they remain open. So that time they are going to call here ductus arteriosus. This channel may sometime remains. Then we call as a patent ductus arteriosus. This patent ductus arteriosus we call as a abnormal after the birth. Ductus arteriosus is a normal in the fetus or fetal circulation. It is abnormal when even after birth it is remains. So this is one we call patent ductus arteriosus, and sometime here the opening directly some venous blood mixing with the oxygenated blood. Then that time we have the shunt blood going from the right atrium to the left atrium. After birth, this foramina has to close. It has to close even after birth, maximum 4 to 8 hours maximum, but it has to close immediately after the birth. But sometime it remains open, we are going to call as a interatrial septal defect. We are going to get the septal defect, that we are, it has to close but it is remains. We are going to call this is a defect. Then we can call as it is abnormal in the after. So sometimes this septal defect is developmentally may be there, but that will also has to close. That is so one is patent ductus arteriosus. What? Then I have told the septal defect is what you have to remember. That is the developmental may, or if foramina ovale may remain same, or it may take time to close. It has to be closed maximum 4 to 8 hours after the birth. If it is remains, it has to close. So these three steps were bypassing portal circulation. Then we are going to again we are bypassing here pulmonary circulation, not there. So these all is very important steps in the fetal circulation. So this is a very important, you have to remember. To revise once again, this placenta is a nutritive respiratory organ. Oxygenation is done and attached to the uterine wall, and that will be attached to the umbilical cord. Umbilical cord contains the one umbilical vein and two umbilical artery. Through the umbilical vein, you have to remember this is a vein, you have to remember umbilical vein, which is carries the blood from the mother to the bypassing the portal circulation. We have the one which is a left portal vein, it joins, and that is a we call ductus venosus. And portal circulation is bypassed and it enters blood, bypassing the liver, enters into the inferior vena cava. This inferior vena cava blood reaches to the right atrium. From the right atrium, blood goes about maximum 80% above that reaches to the left atrium, and left atrium to the left ventricle. From the left ventricle, aorta, it is the supplies to the whole body. Okay. Then some amount which is there about minimum 20 to 15%, that comes to the right atrium to the right ventricle. Right ventricle pumps the blood into the pulmonary trunk. It has the right and left pulmonary. This pulmonary we have artery which is there. These will be supplying the blood supply to the lungs. Okay. So this pulmonary trunk which is there, maximum carrying the blood to the, that is a pulmonary artery, left pulmonary artery, and this there is a communication, maximum blood goes from the pulmonary artery to the aorta connection is a ductus arteriosus, and remains whatever the few amount or very less 3 to 5% of the blood which is supplying to the lung, that is only supplies and coming and joining to the pulmonary. From this again the aorta will be branches supplying the whole body, and common iliac arteries are there. Through that there is a branch which is a umbilical, that is arising, that is carries the some percentage of deoxygenated blood brought by the umbilical fluid, that is the artery. So here whatever you compare with the systemic artery vein, here I have represented vein, umbilical vein as a red because it carrying the mother's oxygenated blood, and here it is supplying all the venous some amount of only deoxygenated blood directly coming through the supplied aorta and reaching through the that is the umbilical artery. To umbilical artery reaches to the umbilical cord and reaching to the placenta and mother circulation. Okay, mother circulation means systemic circulation. Okay, this is what you have to remember, understand this. Then question will be asked, what is a ductus arteriosus? Then it is a communication channel where in the fetal circulation left pulmonary artery joins with the aorta. Then what is a patent ductus arteriosus? After the birth it has to be closed but it remains open, then we call patent ductus arteriosus. Then what is the ductus venosus? After the birth it will be formed the ligamentum venosum. Then you have to remember the vein right atrium. It has the remnants. When it is closed, it is forming the, what is the foramina ovale. Then foramina ovale it is closed by giving the shallow depression, that is a fossa ovalis we call. Fossa ovalis and foramina ovale. Foramina ovale and fossa ovalis. Ductus arteriosus, patent ductus arteriosus. Then you have to, these all are the very important stages, steps, and why the fetal circulation is different than the systemic circulation. Okay, this is all about the total. You have to remember about the